Take a seat.
During SARS, we had a very close and productive partnership with you all, whereby we shared whatever that we knew almost instantly, and what we knew or what we didn't know, what are our worries, what are our hope. And I think that partnership was extremely useful because through you, it then reached out to your readers and Singaporeans at large. And I think I'll give that a lot of credit for our ability to build that trust and cooperation from Singaporeans. And that approach contrasted with a very different approach in some countries at that time. And I think post-SARS, everybody realized that this is the way to do for public health emergency management. And that's why you see this time round, the world's response to this swine crisis is quite different. And I intend to take the same approach with this swine flu. And therefore, we will have to meet quite often. I hope you don't mind, because there's a very fluid situation and bound to have developments by the hours or by the days. And yesterday there was some feedback from some media that some of them were disappointed that there were no breaking news. They thought there was patients, real patients, confirmed patients, or even death. So they were disappointed. And I hope we will always be able to disappoint you, whereby this crisis proceed in that manner. But you can't tell. But my key point is we will meet often, and please don't expect breaking news every time we meet. I think in the last 24 hours, as you have been following the development, the outbreak continues to spread. So confirmed cases have now emerged in 5 more countries: UK, Germany, Peru, Austria, Switzerland. So in total, there are now 12 countries and at least 237 confirmed cases. And the first death outside of Mexico has now been reported in Texas, US, but it is an imported case from Mexico. I think that point has to be noted. While the first batch of cases outside of Mexico had travel history to Mexico, the subsequent cases include many local transmissions. This means that secondary transmission has now happened outside of Mexico, especially in the United States. And that's why WHO has further revised its alert to phase 5, which was, of course, widely anticipated yesterday. We certainly anticipated this change, and that's why yesterday I told you that although we were at alert color yellow, we have actually started to implement several orange measures, especially in the hospitals. With the change in WHO alert, we will formally revise our color code to orange. In parallel, we are also gearing up for red measures at short notice, and we should not be surprised if WHO raises its alert to phase 6 over the next few days, or even over the weekend. You can't tell. But let me put the situation in perspective. First, the whole world is at war with this Mexican swine flu. It's a global war, and every country is or will eventually be involved. It's just a matter of time when cases and deaths will happen in practically all countries. We have been lucky so far, but I think it will not be long before patients or even deaths start to occur here. In Southeast Asia, we are the most globalized country, so the first cluster of cases in Southeast Asia may very well emerge in Singapore. We must be mentally prepared for this scenario and not be shocked into panic or inaction if and when it happens. Second, this war will be long drawn. with several waves of attack. So we must be prepared for a long war. It will not be a quick battle. So we must pace ourselves carefully. We must gear up speedily, but we must also not go into unnecessary overdrive and tire ourselves out, even before the first wave of attack here. And that's why I have advised my hospital colleagues not to overswing. They must gear up and be mentally prepared for immediate operation when called upon. But they should not put everyone on 24-hour battle mode, because that will not be sustainable for a long operation. I think that applies to the media too. Huh? You must organize yourself into teams, so they can back up each other. Just as within Ministry of Health, we organize ourselves into teams. I mean, we have ops group to manage this entire operation, but we organize ourselves into teams. I mean, partly for sustainability, but also partly for business, what do you call that?
Business continuity plan.
Business continuity plan, which is all in our manual, I know the banks are very serious about business continuity plan. Outside the banking sector, I find they talk, but very few companies seriously do so. I hope media should do that. If I may use a battle analogy, we have put some troops on the ground to guard our key installations to detect enemy intruders. We have also set up patrols and sentries in the community to watch out for intruders. But many more troops are on standby to reinforce when necessary. We need them to be well rested and to be fit for action when called upon to do so. Third, we must not be trapped into a SARS better mindset. As I said yesterday, we are fighting a new war. What worked during SARS may not be effective or even necessary this time round. For example, during SARS, the main source of transmission was in the hospitals. But this time round, with flu virus, the main source of transmission, unfortunately, will likely be in the community besides hospitals. And that's why WHO said yesterday or 2 days ago that they have given up on containment strategy. Instead, they would focus on mitigation strategy, treating patients as they come. I do not know whether that statement by WHO expert was well understood by all. Let me try to explain this in layman and local terms. This is somebody coughing. Have you been to Mexico? Let me try to explain this in local terms. This is like our fight against chikungunya versus dengue. When there were only a few imported cases of chikungunya, we went all out to contain it, checking every rooftop, gutters, drains, flower pots, trying to prevent it from sinking roots here. So that is a containment strategy. But with dengue, already here in large numbers and all over the place, containment strategy is not practical or the appropriate strategy for dengue. It has to be mitigation strategy. However, for countries like Singapore, which hopefully are still unaffected by swine flu, we must do our utmost to make containment strategy work, even though we know how difficult, how challenging it will be, because border controls cannot be foolproof with flu virus. But we must try. And that's why we must do more to manage recent travelers from Mexico. With or without symptoms, we have to put them on home quarantine for a week. We must also strongly discourage Singaporeans from going to Mexico. Please don't visit Mexico during this period. The containment strategy cannot fully protect us from this virus, but it will buy us time to delay the attack for as long as possible. Vaccine manufacturers are rushing to produce vaccines, but they need time, several months to perhaps even a year. Every 1 month we can delay the flu attack, we enhance our chances of protecting more Singaporeans. Fourth, Singaporeans cooperated fully with the government during SARS. Your cooperation is even more important now in the war against flu virus. SARS carriers were detectable through high fevers, but the Mexican swine flu carriers can look healthy, like you and me, and they may not even know that they have been infected. Until a vaccine is available, there really are only 2 public health measures which are effective. One is social distancing. In other words, stay away from one another and from big crowds. 2, very high standard of personal hygiene. And that's why we have to keep on nagging Singaporeans, please wash hands thoroughly, frequently, don't touch your eyes, don't touch your nose. I saw one touching the eyes now, and that's wrong. Try to cut it down, wash your hands later. These are simple steps that our grandmothers taught us all when we were young. They sound simple, but they are effective. But you have to be able to do so, practice it all the time. One careless mistake, and if you're unlucky, the virus attack may just succeed. As for social distancing, this applies to all those who are sick or recent travelers to Mexico and the affected regions. Please stay away from crowds, lest you infect them. For those who are sick, stay at home, and if you must go out, please wear a mask. For example, for the Istana open house tomorrow, please stay away if you are unwell or feel unwell. Please stay away if you were recent travelers to the affected regions. Please don't endanger the health of fellow Singaporeans. But for healthy Singaporeans, or those who have not been overseas recently, get on with your life. Go out, exercise, bicycle, brisk walk, go dancing, whatever. We all know when you are active and have enough sleep, you are in top form. You are less likely to get flu. The same thing this time. So don't allow this crisis to stress you out. Have enough sleep, but do listen to your body. If you feel unwell, immediately put on a mask, go and visit your family doctor, and listen to their advice, stay at home. But otherwise, no need to panic, get stressed, and just simply get on with your life. But do read newspapers and listen to TVs and our instructions as we monitor the progress of this outbreak.
Take a seat.